Hello, welcome. Thanks to everyone joining us today for the Friday edition of the Sight and Sound Bites webinar. I'm Carrie Fogel. I'm the Senior Director of Development and Foundation Relations at the Eye Foundation, and I'll be moderating today. As you know, we host these webinars every couple of weeks, featuring different talks on head and neck cancer, vision loss, hearing loss, sinus allergy, balance disorders, voice conditions, and sometimes even more. So I'm really excited because we're featuring a researcher today who joined us a couple of years ago, and his work is really unique, and it's one of our favorite labs and topics to show off when we welcome people to the New Vision Institute at Mercy Pavilion. So we'll be discussing improving outcomes in low vision driving with Dr. Clive D'Souza. And before I introduce Dr. D'Souza, I'll just make a couple of quick reminders that you can submit any questions throughout the entire program. We'll hold them until the end, and I'll moderate a Q&A with Dr. D'Souza. You can ask personal questions if you like, related to your own conditions. We may or may not get to those if they are not particularly relevant to the entire crowd, but we will make sure to get the questions over to Dr. D'Souza and we can get an answer sent to you directly. And as always, there will be a video of today's presentation available on our website. So let me please introduce Dr. Clive D'Souza. Dr. D'Souza is a human factors engineer and researcher. His research program focuses on understanding human movement and mobility and the potential for assistive and rehabilitation technology interventions to address barriers in community mobility, transportation access for older adults, and adults with disabilities. Dr. D'Souza's research group, the Inclusive Mobility Research Lab, uses various bioinstrumentation, wearable sensing technologies, and data-driven computational techniques on gait and mobility and functional tasks. He studies wheelchair maneuverability and spatially constrained environments, driving and driver rehabilitation in naturalistic real-world studies, and examines human performance and human technology integration for improving mobility and transportation access. So a really relevant topic, especially as our population continues to age. I'm sure we'll have a really lively discussion following his talk as well. So with that, I'll go ahead and hand it over to Dr. D'Souza to begin.
Thank you, Carrie, for that introduction. Welcome all of you. And I'm just grateful for the Eye Foundation for giving me this opportunity to present some of my work with all of you, and hopefully also share some of the insights that we are obtaining through some of our research work done at the UPMC Vision Institute. As Carrie mentioned, I'm a human factors engineer by training. And for much of my research career, I focused on accessible transportation. So my work spans various different transportation modalities, including public transportation, driverless vehicles. And what I will be focusing on for today's presentation is mostly on our driving research done in collaboration with colleagues at the Department of Ophthalmology and the UPMC Vision Institute. So what I'd like to present today is to just set some context for why we are studying driving, particularly in the context of low vision. I'll briefly talk about some low vision conditions that affect driving and some of their consequences, and then transition to how we are focusing on improving driving outcomes, particularly among patients with low vision. And there are three broad kind of arms or areas of focus. One is the clinical route, which I'll talk about the low vision clinic at the UPMC Vision Institute and how that interacts or interfaces with some of my work. An on-road driving component. And then thirdly, some research activities that we've been undertaking at the UPMC Vision Institute. And in the course of that, I'll also talk about some driving problems associated with low vision, with vision impairment, that's of interest to us. So with that, I'll set some context for why we care about driving in our work. So driving, at least in the United States, where so much of access to community resources, social participation, engaging um, with family members, with employment, with access to education, much of it depends on your ability to drive. And so it is acknowledged that driving has a profound impact on access, on independence, as well as one's quality of life. And it's often one of the most important questions that low vision patients might ask their clinician is it safe for me to continue driving, or when will I be able to return back to driving? Driving and vision have a very close connection. Nearly 90% of the information processed or received during driving is visual. So it's a very visually dominated task. Specific conditions that might occur maybe as a consequence of aging or even early on or some traumatic event could affect one's vision. And when those effects on vision reduce to a point that they cannot be fully corrected with standard glasses or contact lenses or medical or surgical interventions, we term that as low vision. What is also known is that aging increases one's risk of vision loss. Approximately 80% of Americans 65 and older continue to drive. So driving remains an important part of one's life, even as we age, just in terms of the need for accessing community resources and maintaining an active social participation in the community. It is anticipated that by 2050, nearly 25% of all licensed drivers will be 65 years and older. So almost 1 in 4 drivers is going to be in that age bracket. So it's very important for us to understand how aging and how low vision affect driving safety, as well as people's ability to remain independent in their community. So while other presentations in this webinar series have focused on eye diseases and disorders from a very clinical perspective and provided information on what conditions cause these disorders, what I want to focus on is that from a very functional side is how might low vision conditions affect driving per se. So in terms of everyday life, if you look at common conditions like, for example, cataract, and of course, many cases of cataract can be rectified, for example, through surgery, and may not necessarily qualify as low vision all the time, does impact driving. So for example, I'm showing you an image here on the left, which is what a street environment or an intersection. And of course, this is the perspective of a pedestrian. Those are the only images I could find. But showing you a pedestrian at an intersection with normal vision. And then if one has cataract, how that vision might be degraded. So it might affect one's, what we say, contrast sensitivity, their ability to detect different areas of black and white and gray, and hence certain road signage might be difficult to read, or certain roadway markings. For example, the pedestrian crossings in this case might start to look a little blurry, and the edges of the road may not be very clear. And so that's one example of how cataracts could affect driving and driving safety. Among the more common low vision conditions in the US is age-related macular degeneration. And this condition affects both it affects central vision, which is primarily what we say our acute vision or visual acuity, our ability to pick up small, fine details. We rely on central vision for reading. So for example, reading road signs or reading the dashboard on one's car, or looking at the speed limits when driving. So one of the consequences of a condition like macular degeneration is there's distortions or these scotomas in one's field of view. So what I'm showing the image in the middle here is a very early stage of macular degeneration, where there might be certain blurry spots towards the center of one's visual field. As the condition gets more advanced, those scotoma or those blind spots start increasing. And you could imagine how, if one were driving with a condition like this, it could affect your ability to read road signs, um, detecting the cars in front of you or pedestrians at the side of the road when you turn your head, and how that could lead to somewhat unsafe driving conditions. Glaucoma is another common condition that affects the peripheral vision. In this case, the outer boundaries of one's vision start getting affected, they start becoming more opaque, and that field of view starts decreasing. Central vision in this case tends to stay relatively intact, but it's the peripheral vision, the things that you see on the side. So for example, when driving on a road, you might now fail to detect pedestrians standing at the side of the road, or the edges of the road, for example, when making a turn, and that might cause one to ride over the sidewalk. Or you might miss a fire hydrant that's to the side of the road when you're parking. So glaucoma is, again, a very common condition that could have severe impacts on one's driving ability. Another common condition is diabetic retinopathy, where it starts affecting both central and peripheral vision. So you start seeing these blind spots throughout the visual field, central and peripheral. And this is an example shown on the right here. And again, as this condition worsens, those blind spots, those blurry areas start to increase in size. And now you're, again, it limits one's ability when driving to pick up all these details, all these moving events, these cars, road signs, pedestrians crossing the road, bicyclists, all these potential hazards that one might encounter when driving. Although not specifically a vision condition, stroke does affect the visual processing areas of the brain that could affect one's vision. And one common condition under stroke is heminopia. In this case, what I'm showing you an image here on the left is a case of left heminopia, where there is a complete visual field cut. So there's a restricted or limited field of view on one's left side. And so in this case, a driver is going to miss a lot of the hazards or the events happening on the left side. This could be things in their rear view mirror, or pedestrians on the left side trying to cross the road, and hence leading to accidents, for example, either in crowded intersections or when making a left-handed turn. So given this background of how low vision impacts driving, we've got three main directions or avenues that if a person has low vision, they could take in interacting with us in terms of their driving or fitness to drive. We've got three arms. One is a clinical, one is an on-road driving component, and third is our research arm that I lead. On the clinical side, we've got the UPMC Low Vision Clinic, and that's led by Dr. William Smith and a lead therapist, Holly Stantz. And their focus is primarily on conducting comprehensive low vision assessments, discussing with patients rehabilitation and treatment options. And these kinds of assessments are often done by an optometrist, a low vision rehabilitation specialist, occupational therapist, and certified low vision therapist. So it's a very clinical focused approach. And if individuals have concerns about their vision, they're often encouraged to contact this low vision clinic directly. If one is interested in understanding their fitness to drive on the road, this could be someone with a recently acquired low vision condition, or where they're starting to notice degradation in their vision and perhaps some safety critical incidents when driving. Or it could be someone with a condition that is from birth or early on in their life, and they've never driven before, and they're interested in assessing their driving capability. In that case, they'd be encouraged to contact the University of Pittsburgh Adaptive Driving Program. The focus here with the therapist is to conduct specialized assessments to help medically at-risk drivers. So this includes individuals with low vision, but also spans individuals with physical impairments and mild cognitive impairments. The adaptive driving program is run by certified driver rehabilitation specialists who also have training as occupational therapists, but they have a very specific set of skills to evaluate medically at-risk drivers, both in the clinic and on the road. The adaptive driving program also serves another important function. The results from their evaluations have direct implications on one's driving eligibility and or current driving license. The adaptive driving program communicates their findings with a particular patient with state driving licensing agencies like the Pennsylvania DMV. A third arm of driving with low vision involves the research component, trying to understand and evaluate how individuals with low vision interact with their environment, trying to understand how different rehabilitation treatment plans or training programs could improve their driving and continually assess this, and also see what new avenues or pathways to improve driving and driving longevity in these patients can be developed over time that can then be integrated into clinical practice in the future. So I lead the driving research component at the Vision Institute, and the centerpiece of our research is a driving simulator, along with other research instrumentation that allows us to study these components in much detail. As part of my work, I collaborate regularly with the Low Vision Clinic, as well as with the Adaptive Driving Program. So I'll go through each of these with a little bit more detail, but this just gives you a quick overview of the pathways that one might have if to engage with us in terms of driving. Either with the Low Vision Clinic or with the Adaptive Driving Program, the clinicians there will be conducting very specific tests in the clinic to assess one's vision in the context of driving. Examples of some of these assessments are tests of visual acuity. This could be acuity that is near acuity, far acuity, binocular, meaning with both eyes, as well as monocular. And this is a little bit more detailed than what one might encounter at a DMV test, for example. There are tests conducted to understand contrast sensitivity, the ability to see in low contrast, and so distinguishing between white and gray and black in different kinds of conditions, which could again be related to detecting road markings, for example, or objects in the environment. Glare is another important factor for driving. So understanding how vision is affected by bright lights. This could be day or night conditions. And so there are very specific tests that a clinician would undertake to assess your susceptibility to glare. Then peripheral vision. So we've talked about how some of those medical conditions could affect peripheral vision. So there are very specific tests to understand your side vision, your ability to detect hazards on the side, on the right or the left side. And there are specific thresholds or limits given by state licensing agencies on what is an acceptable or unacceptable limit of peripheral vision. Other tests might include things like color perception, being able to detect color, for example, when trying to distinguish between traffic lights, understanding depth perception, so judging distances, for example, between yourself when driving and the car in front of you, if it's at a safe distance, or distance to a particular target, for example, a bicyclist or a pedestrian that might be crossing the road, and just trying to understand if you're maintaining a safe gap or distance between you and this potential hazard. And then there are other specific tests that could be conducted that have to do with eye movement. So this could be saccadic vision or pursuit movements, and looking at this muscle balance between the right and the left eye to check for an alignment. So the key point here is that there are a comprehensive range of tests that a clinician might recommend based on one's particular medical condition to understand their fitness for driving from a clinical perspective. All of these tests happen in a clinical setting. So at this point, nothing has happened in the car yet or in the vehicle yet. So that's our next step. The University of Pittsburgh has an adaptive driving program. So these are, again, trained specialists with an actual car. So in this case, you'd be working both in the clinic as well as on road in a car if deemed fit. The main purpose of this adaptive driving program is to provide support for novice drivers, or could be drivers that are aging or older, or drivers with physical limitations, and I should say that even perceptual or cognitive impairments, and to help them assess their readiness for driving, determine continued fitness for driving, as well as their suitability for any adaptive equipment. And I'll provide a few examples on my next slide. I've mentioned before, the adaptive driving also serves this important function of communicating their findings with state driving licensing agencies. So they provide them with evidence of the results from their on-road test conducted by a comprehensive driving evaluation, and to support findings about the person's suitability for continued driving, so their fitness to drive, or in some cases, it could be driving with a restriction. So examples of restricted driving could be driving only a driver's permit that allows you to only drive during daytime, or within a specific distance, or on specific roads and routes, or a specific speed limit, or under certain weather conditions. For example, only in the summertime or when it's not snowing or raining. So these could be different levels of the results that could come out from one of these comprehensive driving evaluations. This is a quick summary of some of the services provided by Pitt's adaptive driving program. So there's a pre-driver clinical assessment. Again, these are assessments done in a clinical setting. Followed after that, one might be recommended for a comprehensive driving evaluation. So this is done in an actual car on the road with our trained specialist, where they will evaluate you, much like you would do for a driver's license test. But in this case, they're actually assessing the deficiencies that one might have in driving, whether it's related to central vision or peripheral vision or depth perception. And they're kind of developing a customized plan for each client that they see. Based on their evaluation, the patient or the client could be recommended for driver training. This could be, again, repeated practices done in the same vehicle in subsequent weeks or months to help them develop certain skills or certain competencies with regards to their driving, and to adapt to their very specific condition, whether it's a physical or visual limitation. In some instances, the specialist might even recommend adaptive equipment. So for someone with, for example, a lower extremity problem affecting their right leg, they might recommend something like a left foot accelerator or hand controls for braking as well as acceleration if a driver is unable to use their feet properly or adequately. Steering devices, like an image shown here on the right, where the steering wheel is fitted with a spinner knob. So in this case, a driver could operate the steering wheel with just one arm or one hand. Another example of equipment could be driving with bioptic lenses. In recent years, Pennsylvania has approved, under very specific conditions, driving with bioptic lenses. An example is shown here, where one's glasses are fitted with a very specific set of magnification lenses on the top frame, so they can see, for example, road signage or speed limits during driving to compensate for that loss of visual acuity. A lot of these assessments, again, are done through our driving program. And if one is interested in them, I highly recommend reaching out to this driving program. I'll provide their contact information on the next slide. In certain instances, there could be other vehicle modifications recommended. For example, if someone's got a peripheral vision loss or a visual deficit, there could be additional mirrors added. There could be convex mirrors, so they could get magnification of objects that are behind the car, or additional mirrors, larger mirrors. So these are, again, recommendations that could be made to compensate for one's vision impairment in the context of driving. Our adaptive driving program at Pitt is managed by Melissa Alexak, who's and Melissa is actually in this photograph right here, working with one of her clients, in this case with a steering hand controls. I've provided here some contact information for the adaptive driving program, their phone number and their website, which has some comprehensive information about the types of services they provide, as well as eligibility for individuals. So towards the end of this presentation, I'll talk a little bit about the research side of things. So we've talked about the low vision clinical assessments. We've talked about adaptive driving program on the road. And then between these two and working collaboratively with them, we have a research component of our of low vision and driving as well. The centerpiece for this is our driving simulator, which is housed at the UPMC Vision Institute. And this image just shows you some key features of our simulator that I'll point out. One is that this is a fully equipped driver console, so that have components from an actual car. So it's a very realistic and high fidelity in terms of its in terms of simulating or representing the components used during driving. The three large screens that are here provide a full 180-degree field of view, much like what one would see if they have normal vision. So you can see the full side to side, the full range. The software also simulates the three mirrors. So you've got an overhead front mirror on the center screen, and then a rear view mirror on the left and the right side. There is audio. There's a full 180-degree field of view for the vision, as well as a motion platform, so it can simulate movement. So you get this realistic feeling of actually being in a car when you accelerate or when you brake. The entire platform, in a sense, moves or responds to those movements. What this allows us to do is to study how people drive, what are their driving behaviors, what is their performance under very controlled conditions and under very specific situations. So we can control the amount of traffic on the road, the amount of pedestrians or bicyclists, the weather conditions that one might be driving in, as well as the safety. So in this case, since it's a simulation, if there are any safety critical incidents or accidents, there's very little consequence to them, unlike what would happen in an actual car if doing an on-the-road evaluation. So there are, at present, about 3 focus areas for us as part of our driving. And again, this is just another example showing you the driver's view from our simulator. So in this case, when you're from the driver's point of view, they can see the roadway ahead of them. It's a fully kind of immersive experience. They're also able to see their dashboard, so you can gauge your current speed from the speedometer, the fuel level, or other kind of engine check lights that will come on. We've got controls for the lights, for the headlights, as well as other secondary controls, such as their for the air conditioning and on your center console, that are in a sense replicated or simulated to capture that feeling of being in an actual car. After a few minutes of being in the simulator, one does get this feeling of being kind of immersed in this environment, where we start seeing behaviors that are actually very representative of real world driving. So in this case, maintaining your adequate gap between you and the cars in front of you, staying within your lane, changing lanes. A lot of those behaviors can be observed based on different driving scenarios. In this case, a highway driving situation. 3 things that are focused to us. One is understanding driving performance. How is the vehicle and car together performing in this space? What is their speed? What is their acceleration? What is their braking? Is the driver maintaining their position within the lane? And so this is another view of the same driving simulator. And in which case, you're seeing the image on the left has a computer where we can record data about the driving performance of our particular client. So in this case, you'd be recording information, like I mentioned, about speed, distance traveled, lane deviations, any safety critical incidents would be captured here in terms of the numerical data as well as behavioral video data. So understanding performance is one aspect. Second has to do with understanding safety behavior. Safety is an important aspect of driving. We want to make sure that people that are driving themselves are safe, but also not presenting a hazard or a threat to other drivers or to other pedestrians or to other road users. The simulator allows us to understand and quantify some of these behaviors in a lot more detail. And I'll show you some examples. And these are also good indicators of safe driving that one could use as a safety, as a self-assessment. So if one is experiencing some of these symptoms or noticing these, let's say, because of a medical condition or an older driver, it does become a point of discussion when seeing one's clinician or optometrist the next time, right, at a future appointment. So one focus for us is understanding how drivers are aware or maintaining that situational awareness of the environment around them by means of visual scanning. When working with our therapists and research team in the simulator lab, we are paying close attention to how the driver is scanning their environment. How often are they looking at the road in front of them, paying attention to the cars beside them or that might be passing them in the adjacent lane? Are they making sufficient glances down to the dashboard to monitor their speed in relation to the current speed limit? Are they staying in position in the lane? Are they checking their rear view mirrors when changing lanes to make sure that there's no other vehicle in that blind spot? So these are kind of behaviors, safety-related behaviors that we are interested in capturing and understanding as we have participants go through this driving simulator, our driving simulator studies. Another example, which has to do with central vision, is picking up small details. In this case, in our simulator, you can see as the person is driving, there are a couple of things happening here. One is there's a road signage to the top of the screen indicating the current road and at what point they might need to maybe take an exit. There's also some instructions given in terms of their speed that we provide them on the screen. And if the driver is not paying attention, or if they have a problem with their central vision that affects their ability to read certain small details, then they would not be processing this information correctly and then making mistakes during driving. For example, in this case, they would probably miss the exit that they're supposed to take. So again, we can start studying these very driving specific behaviors in the car using our simulator and by programming very specific situations or instructions to them along the way. One critical aspect of driving with low vision has to do with the errors in judgment of distance, speed, and lane position. So, for example, if a driver has got a problem with a peripheral vision, we might see that they're not staying towards the middle of the lane, but actually driving to one side. So it's an improper lane position, or they might, as they're driving, they might be drifting off to one side, either to the right or to the left. So noticing such behaviors from our end gives us useful information about how we might provide them with some corrective feedback, as well as some strategies on how to improve their driving safety. Other examples of errors in kind of depth perception have to do with noticing behaviors like making wide turns or being unable to judge the distance between oneself in the car, for example, and a vehicle in front of them. So in this case, we've intentionally have a truck that's parked on the road. And as this driver is approaching them, we're noticing at what point they're able to take evasive action, for example, changing lanes and slowing down, checking their mirrors to make sure that they're not hitting another car that's parked across from them, but also not hitting the truck that's parked before them. So the simulator allows us to introduce these very specific hazards or threats in the environment and then study how drivers respond to these potentially unsafe situations. Another example has to do with poor contrast sensitivity and color vision. So again, these are examples that tie to our previous medical conditions. We talked about things like cataract, um, uh, or things like diabetic retinopathy that might affect some of their visual capabilities, and now it has an effect on driving safely. It's hard to notice in this figure, but at the far end of this intersection, there's a traffic light, which currently is green, as well as an additional green arrow that's shown. Noticing hesitation or delay or a response latency or a delay by the driver when these lights change are, again, good indications for us as we are observing the driver that gives us feedback on difficulties or challenges that this person might be experiencing in terms of driving. So for example, if one has got poor color vision, they may not detect the changes in the traffic light signal very quickly. And there might be a delay or a lag, or they're watching for other cars if they're stopping or proceeding in terms of making a judgment about when it's safe for them to cross because they're having difficulty distinguishing between the traffic lights. Problems detecting lane markings, seeing where the driver comes to a stop, for example. Are they coming to a stop before the lane marking on the road? Or are they kind of parked or on the side, close to the sidewalk or between lanes? Again, that's giving us an indication of their problems with contrast sensitivity. One last example that I'll show is issues with glare. One might experience this, for example, when driving at nighttime. When oncoming traffic have got their headlights on high, and now your inability to detect where the roadway might be or the lane markings or how far one is from the car in front of them because of these headlights that might be affecting one's vision. Under normal conditions, one should still be able to drive, but if there's a medical condition that affects glare recovery, then it's an almost blinding-like experience for that short period of time, which could lead someone to encountering an accident. This is a problem often at nighttime. However, it could also be a problem with when driving, for example, in areas that might be suddenly brightly lit and then suddenly dark, for example, a shadow from trees, or driving in and out of tunnels, so going from light to dark or dark to light, or driving under an underpass, so it's bright outside and suddenly it becomes dark, and then now it becomes bright again. We term that as dark light adaptation. So issues with such adaptation or these transitions going from brightly lit to dimly lit areas could be a problem for certain drivers and could be a safety critical area of concern. So we've talked about driving performance in terms of speed, accelerations, lane position. I've talked about some safety critical behaviors that we're interested in observing in our driving simulator across these different studies, as well as the third area, which has to do with visual attention. We are also interested in understanding here how low vision conditions affect people's visual attention, what they are paying attention to in the environment. Are they detecting certain hazards or threat correctly in time, or are there delays in recognizing these kinds of hazards? We are in the process of acquiring a eye tracking system, and this is just some examples of the type of information or data we could get from eye tracking that gives us insight into visual attention. On the image on the top are certain dots or areas of fixation, places where the driver has looked at in the environment, as well as the sequence in which they've been looking at these different points in the environment. We see a cluster of points on the road ahead, which is actually a good sign. It's indicating to us that the driver is spending most of their time looking at the road in front of them to make sure that they're staying in the lane, make sure that they're avoiding oncoming traffic, or they're not getting close to the cars in front of them. So again, this is a good indication. And occasionally they're also scanning to the right side to make sure that it's safe. One example over here could be seeing points of fixation or what do you say, dwells only to one side of the road and not the other. So for example, if a person is neglecting the left side of the road, I mentioned the example before of a patient with stroke that might have left heminopia and they've got a visual field deficit. They might be avoiding or might be ignoring aspect of the roadway on the left side. And again, using eye tracking data like this, we could get an insight on if they're actually ignoring the left side, and maybe we need to provide them with more feedback or strategies on how to compensate for that deficit to increase their scanning patterns on that left side. This system also gives us information on how often the driver might have checked their rear view mirrors. Are they looking more often or less often in the right versus left side mirror or the overhead rear mirror? The amount of time spent looking at objects in the mirror versus the road in front of them. The amount of time they've spent looking at the dashboard below, which is eyes in a sense off the road. So these kinds of numerical data give us good insight into how one's low vision condition is manifesting in terms of their driving behavior and driving safety. Based on this feedback, our patients can then work with the low vision clinic therapists to develop some remedial strategies or compensatory strategies. So some examples of them are listed over here, things like training on visual scanning techniques that utilize their remaining vision. So developing better habits or strategies through practice, through retraining on head movements to compensate for visual field deficits. Shown here is one of the equipment used by our low vision team. This is the Dynavision. And these are very specific exercises that can be administered on this device to help patients develop scanning patterns to compensate for example, their visual deficit on the right or the left side using a very customized training program. We currently have a study that will begin recruiting next year on trying to understand how these kinds of low vision rehabilitation training strategies affect driving. So trying to quantify the effects of these training strategies in our simulator, both before and after they conduct these trainings. So this is a study that we've got funding from the National Institute for Disability and Independent Living and Rehabilitation Research through the Administration for Community Living. We've not yet started any data collection yet, but we hope to start next summer, trying to, again, understand the effects of these low vision strategies, rehabilitation strategies on driving safety. So that's all that I have for today's presentation. I'm happy to take any questions from our audience members, as well as provide any more details or resources if you'd like to know.
Thank you so much, Clive. That was really great. I appreciated how you divided the presentation to kind of talk about how people would, come to interface with any of the driving simulators or the on-road simulator. And so we have naturally a lot of questions. I think people wondering how one would get connected and kind of the process that looks like. So talking a little bit about that before we dive into the research. Are there fees for participating in any of the adaptive driver programs or studies, or even just trying the driving simulator to kind of test your own abilities?
Yes. So I'll go back to the slide, which has got the three options over here. So one is if low vision is a concern, then I would say reaching out to the low vision clinic would be the first, the most likely kind of pathway to take. And if driving becomes a concern, then the low vision clinic therapist there would either contact me if they think driving simulator is of benefit, or they would contact or send a referral to the adaptive driving program if they think this patient can actually transition to on-road driving directly, right? Right now, our driving simulator is more of a research tool. So we want to understand, we want to measure, we want to study different things, but we don't have the ability to make drivers licensing decisions in the simulator. That needs to happen with the adaptive driving program on the road. The adaptive driving program does have their own fees. There is a referral form on their website where one could either self-refer or they could be referred by their optometrist at the low vision clinic or any other optometrist. Those fees are separate. If they get referred through things like the Office of Vocational Rehab, there might be some avenues to mitigate those fees. But there is a specific fee related to that program. With regards to research, we've not started active recruitment yet, but we hope to later at least the middle of next year. And in the case of research studies, if interested individuals that qualify reach out to us at that point, they would not be paying, in a sense, we would be paying them for their time and for their participation in the research studies. So again, there are these three different routes that one might take. Both the clinical route obviously has got your its own fees with medical insurance and things like that.
Do you go out on the road with visually impaired individuals to help them with the adaptive technologies?
Not me. I focus on the research, so in our lab, but in this middle box over here, the adaptive driving program, yes, they do have their own car that is fitted with certain equipment where they can take patients, clients with low vision, like I said, or with physical impairments or with certain cognitive impairments. They will take them on the road if they deem it suitable to assess them. So they do a two-part assessment. They do a clinical assessment, and then they'll do an on-road assessment. In some cases, they will do both, but if one has a very severe vision condition, for example, they may just do the clinical assessment, and that would be enough to tell them that, okay, maybe it's unsafe to be driving.
Okay, I see. Thank you. Are there any federal guidelines for when someone should or should not be driving?
There are some general federal guidelines, but really it's the state guidelines that dictate a lot of the specific requirements in terms of driving eligibility, one's driving license, as well as if one needs to drive with what you said, like a restricted driving license, like driving only at daytime, driving only in a certain distance. So that's these state driving license agencies, SDLAs. So my suggestion, so one is the Pennsylvania DMV website has got a lot of information. However, if one's unsure how to interpret those instructions with regards to their own driving with their own medical condition or maybe that of a family member, then I would suggest, again, contacting the adaptive driving program and they can help you navigate that process.
Great. So I have a follow-up question on that, and someone is a little bit curious about, I guess, maybe they have a vision issue, but they don't want anything on record. So their question is, can someone wondering about their driving try the driving simulator before meeting with the adaptive driving program so that nothing is on record?
That's a tough one. I generally would not be sending information to the driving licensing agency. Like I said, it's more like a research tool. If you're interested in exploring driving in the simulator, at present, I would suggest the best way to do that is to contact the low vision clinic first, and their therapists can then coordinate with me. That would be, I think, one way to do it, where they can just come in and explore.
Okay. Is there any chance of the driving simulator evaluation being done for all drivers over a certain age?
Not at this point, but our hope is by conducting this type of research in the future, simulators can become a more central, or at least let's say a useful part of the licensing process, right? So one is both the access to driving simulators is easier because now it's it's not a vehicle which might be only very few. We can have more simulators. These could be accessed at different times. They could even be more, what do you say, like customized feedback or training that one could spend on the simulator. So our hope is that by this research would actually lead to changes in driver remediation in the future. Presently, simulator-based assessments are not considered definitive in terms of driving. They're only a tool in the process. It is the on-road assessment or evaluation that has the most validity at present.
Great. So you may have touched on this in your presentation, but someone is asking if there is a specific adaptive device, like glasses or lens, to improve night driving and headlight glare that you would recommend.
Yes. So again, working through our low vision clinic, they would, from a clinical perspective, they would help provide those rehabilitation aids. There are specific types of tinted glasses or with an anti-glare kind of material that could be suitable for a particular person, depending on their condition. Again, that would be the domain of the low vision clinic because they can provide that very specific clinical guidance at this point. They might bring in the person on our simulator for some test, but it's really the low vision clinic that would make that determination.
Okay, so that would be their place to start then.
Yes.
Okay, our next question says, I'm a 71-year-old male with glaucoma-related low vision, OD only. I'm in Austin, Texas. Would I have to travel to UPMC, or are there other low vision clinic and driving labs elsewhere?
No, you do not need to travel to Pittsburgh. There are resources elsewhere. And in fact, I'd say the resources in all three categories. There are low vision clinics in other parts of the country. I do not have their specific like a list of them, but I'm pretty sure that you should be able to find some online or through your local your regional medical center. There are trained low vision specialists in different parts of the country that can provide you clinical care and guidance. There are also adaptive driving programs around the country. Not many of them, but I think we have about, I want to say about 200 across
Oh, wow.
the US, but they all have a slightly different focus. Not all of them might be working with low vision. Some might be working primarily people with spinal cord injury, or with wheelchair users, or people with mild cognitive impairments or autism or neurological problems. So finding one near you would be the closest bet. There may not be one in your city, but maybe one in an adjacent city. But I'm pretty certain in Texas there are at least a few of them. I'd recommend looking at the website, and I can post this in the chat. It's the Association for Drivers. It's called ADED, and their website maintains a list of all certified driver rehab specialists in the country. And so through their database, one could identify the closest rehab adaptive driving program and rehab specialist who can work with them one-on-one in terms of on-road driving. Driving simulator labs are less common. There are some across the country, but they're primarily used for just research. But again, I would say those are the fewest. If driving really is the focus, then I would say trying to find out the closest adaptive driving program to you.
So someone is asking, how would I contact you regarding participation in your research program?
Yes. So right now, like I said, we have not started We've not received approval to start data collection yet. So my suggestion again would be if this potentially might be of interest, contact the low vision clinic, the therapist there, and then we'll make sure that we'll reach out once our studies begin.
I think we have time for about 2 more questions. So, what is your opinion about self-driving cars for people with low vision, and how will these cars alter your research?
Great question. It's something that we are paying close attention to. It will definitely affect driving, but in many different ways, right? So as of now, there are some technologies, not fully automated, but semi-automated in terms of, for example, lane position. So Carrie, I think I've posted the link in the chat, but it's only going to the host and the panelists. So
I see. Okay, I'll make sure
Yeah.
to include that information.
So right now, a lot of assisted driving features, things like automated cruise control, blind spot warning detectors, cannot be part of a driving license assessment. You have to demonstrate that you can drive fully, in a sense, with your own capabilities and not rely on these technologies. Now we hope by conducting research, including in our research lab, that in the future, these licensing requirements will change as technologies become more adaptive and as we show evidence that these are actually helping certain people become safer drivers. In our study, we'll also be, in a sense, simulating certain assistive driving features, some automation features, to really understand how they affect low vision drivers. So it's something that we're also interested in. In terms of fully self-driving cars, we are still many years away from that. And even if once they become available to us, the issues of costs and access to these vehicles, their location, often these self-driving cars only operate within a very specific geographical area based on where the sensors have mapped the roads. And so there are certain restrictions before these technologies can really become ubiquitous and commonplace and accessible to all of us. So we're still years away. But even then, so for the foreseeable future, we'll still have human drivers, right? And as long as that's the case, research like this is still critical to help understand and improve safety for drivers with low vision. But it's a great question.
Yes, there are still limitations, but always looking forward to the future and new innovations. So I think those are all the questions that we have for today. So with that, I'd really like to thank you so much for your fascinating presentation and for everyone joining us and spending their lunch hour with us. And we wish you a wonderful rest of your day and weekend. Thank you so much.